This week we'll be covering what personal informatics is and how we benefit from using this tool. Personal informatics is a class of tools that help people collect personal information by monitoring the collected information over time so that the individual could self-reflect and make the changes needed. These collected information could be related to one's height, weight, blood pressure, and so forth. In the age of technology, it has never been easier to track set goals and accomplishments. Numerous apps on cell phones are designed to watch your diet, calorie intake, as well as provide a personal trainer to be more physically active. Fitbits and Apple Watches provide on-person heart monitors to track daily physical activity and your heart's beats per minute throughout the day. But what does this mean for us as humans, now that we don't have to go to the doctors to check our physical selves? We as humans can set goals, change our diets, behaviors, habits, and reach your desired goal. But most importantly, we can cut costs down on healthcare.
Being able to self-monitor your own health patterns is becoming more popular and a new philosophy and trend for life. Digital health journalist Arthur Olish argues how self-tracking biometrics influence patients, medicine, and society as a whole. Quantified self-tracking will revolutionize healthcare and also influence a positive boost in well-being for all individuals. The ability for an individual to monitor their heart conditions, mood, and even air quality is a proactive step forward in an effort to improve the world's healthcare system. Devices such as Fitbit are easily wearable and gives an objective insight into people's everyday activities. Fitbit and other devices such as smartwatches or an iPhone or an Apple Watch can track and monitor people's heart rate, steps, sleep patterns, and even environmental factors that surround them. The trend of self-tracking through the use of technology has become a fast expanding global market. According to IDC, wearable markets in 2018 grew by 27.5% with 172.2 million devices shipped. Technology is becoming such an important and viable option to improve health of everyone, and companies are beginning to see the benefits. Silicon Valley startups are creating a new medical tricorder, which is a portable scanning device for self-diagnosis that can happen within a few seconds. Overall, the improved science that supports the structure of innovative technological advances that can improve people's health is becoming public health priority number one.
Now, we're going to talk about the paper Personal Tracking as Lived Informatics. Given the intense interest in personal informatics, and especially for health and well-being, the author did an interview study with activity tracker users and reported in this paper. Placing posters to advertise activity trackers, the research provided an initial unstructured interview and then follow-up contact 1 month later to discuss about their feelings and evaluation of the trackers they used. It combined both quantitative and exploratory methods to make the results more reasonable and scientific, yet based on an inaccurate assumption about whether people would use the new trackers provided by the research. However, the sample is random that includes people different in gender, exercising custom, body shape, living place, occupation, and whether they had used pedometers before. So I will say, even if flaws and bias still exist, the study is justified and reliable.
In the study, participants did not just use one tracker, but rather several different types to integrate various areas of their life. The study also brings up how sometimes these areas had a clear separation, while in other times they kind of merged over. For example, somebody used a food logging app and a pedometer keeping track of the nutrition area and then the travel area, but others also used a pedometer and a running app to keep track of both sometimes, and so that would cause each of their areas to merge. The study also noted how problems arose when trying to integrate data when it came to syncing data across devices and apps. I personally think this is important to note since many participants hadn't used a particular tracker for more than a year. This could be potentially the reason why. I myself have used a Fitbit and MyFitnessPal account, but I always run into errors when I try to sync my account across devices, be it my iPod or my personal phone or even on my laptop sometimes, to the point where I found it really tedious and I stopped using either. So assessing this kind of problem of integration could also support the use of personal informatics for each person, and therefore cause more people to start using it. The article itself explained how personal informatics tracking is often social, so people can share the benefits of such experiences and therefore encourage each other to start using it more.
Hey guys, I'm Ivy, and some tracking technologies that participants included using mobile apps like Nike Fit, extra games like Wii Fit, physical devices like the Fitbit, and web apps. Some tracking methods other participants used included manually recording food and beverages intake, exercise time, sleep schedule, and even their weight. In doing so, users can see the long-term evolution and so can health professionals. We see these technologies and methods being used very often these days. For example, I use a mobile app that tracks my period cycles and symptoms because they are long-term and recalling them at the spot for doctor's appointments can be hard. There are 5 styles of personal tracking. Just to name a few, there's 1. Directive tracking. This is goal driven and users often set a number they hope to reach by a certain time. 2. Documentary tracking. This is when users record their steps or calories to gauge about how much time or intake it takes and then use it to predict their next steps. And 3, the last one, collecting rewards. This is similar to documentary tracking, but there is usually an incentive behind it.